An estimated 2.2 million Americans have epilepsy, a medical condition that causes seizures, and 140,000 new cases are diagnosed each year. Here in St. Louis, Dr. Daniel Mattson, a neurologist and epileptologist, is working to help patients better manage their condition through the Epilepsy Monitoring Unit at SSM DePaul Health Center.
Epilepsy is a complex disorder which encompasses a number of different neurological problems. It's caused by uncontrolled electrical activity in the brain in its very simplest explanation. That can be caused by any number of different conditions. Some of the more common ones that occur in older age would include things like strokes or tumors or other neurological problems that cause seizures and thus can cause epilepsy. On the other hand, in the younger age group, it's usually caused by genetic factors, and people can be born with the things that give them the tendency to have it. Seizure refers to a broad array of different behaviors that can occur due to electrical activity in the brain that's uncontrolled. The most common one that many people are aware of would be a convulsion or shaking of the extremities. This is usually accompanied by loss of consciousness, falling to the ground, and so on. However, almost anything can represent a seizure depending on what part of the brain it occurs in. Sometimes it can be as mild as being confused for a period of time. It may consist of movement of one arm or one leg in isolation without the rest of the body being affected. Or, for example, people can have unusual sensations such as numbness and tingling in a limb, change in their vision, or other things that affect a smaller part of the brain and don't spread to the brain around it.
There are situations in which someone may have a seizure not caused by epilepsy, including some types of metabolic imbalance, like a low sodium level or other electrolyte problems, or an excessively high or low blood sugar level in a diabetic person. For this reason, a careful diagnosis is vital. The first step is a complete medical history, followed by tests in the neurologist's office or in a hospital.
These would include such things as routine laboratory testing for some of the conditions that could cause seizures or provoke seizures to happen. Also an EEG, which is a brainwave test as it's commonly known, which can show seizure activity even when people are not actively having a seizure. And then finally, an MRI of the brain is usually performed to make sure that none of the other conditions which could provoke a seizure are present.
If after this examination a patient's tests are normal, but he or she continues to have seizures despite treatment, the next step would be long-term monitoring.
The Epilepsy Monitoring Unit is a very exciting development at DePaul Health Center. This center allows us to have one of the few regional centers where people can undergo very detailed testing for epilepsy diagnosis and treatment. What we do is bring people into the hospital and under very controlled conditions where they can be observed for a long period of time and watched carefully under nursing supervision. We can take them off their medications if they're on any and hook them up to an EEG and video recording and watch them for up to a week at a time, sometimes longer. In those situations, we get a lot of information recording EEG 24 hours a day, and this allows us to have a very sensitive trigger for finding events and determining what type of abnormalities are going on, if any. The equipment that we currently utilize is the state-of-the-art as it currently exists. We have all the capabilities of any other monitoring center or better, and it allows us to give the absolute highest level of technology and care to our patients.
About 2/3 of patients with epilepsy are completely controlled with medication alone. If the patient has failed trials of multiple medications in combination, their seizures are worsening, or there's some other indication that they may have an abnormality in their brain, then other treatment options are available, such as surgery or the use of a vagal nerve stimulator. With the surgical option, a surgeon removes or isolates a particular area of the brain that is the source of the seizures.
Not all patients may be appropriate for surgery, however, because of where the seizures come from, or perhaps because their seizures come from more than one spot. In those patients, then additional treatment may be possible with a device called a vagal nerve stimulator. Vagal nerve stimulator is a device attached to the vagal nerve in the neck, which generates a pulse which is transmitted to the lower brainstem part of the brain. The hypothesis for how this device works is that it causes disruption and inhibition of the signaling that occurs between different parts of the brain and thus makes it less likely for seizures to propagate. Vagal nerve stimulators typically will reduce the number of seizures a patient has by about half, which is similar to medication efficacy. Patients who undergo epilepsy surgery or vagal nerve stimulator implantation do remain on their medications following their surgery. The risk of recurrence of seizures is much higher if the medications are stopped, and therefore they will usually remain on some type of medication, although maybe at a lower dose for the rest of their lives.
With medication therapy and other treatment options, SSM Neurosciences Institute can successfully manage and treat epilepsy to reduce or prevent seizures and help patients lead better, safer lives. For more information about epilepsy treatment and monitoring services, call 314-355-3355.